Hello, my name is Elizabeth Raya and I'm a family nurse practitioner student here at UTRGV. I'm going to be conducting a cardiovascular assessment and a peripheral vascular assessment. We both consent to be recorded and this video is able to be used for educational purposes only. So I had my patient go empty her bladder before coming into the examination room and change into the gown to better assess. I went ahead and took her vital signs, all were within normal limits. Her blood pressure was 120/80, pulse of 75, oxygen at 100% on room air, and respiration 16. She denies any past medical history, any past surgical history, no allergies to medications. She's a 26-year-old female coming in for a physical assessment. So for this examination, I'm going to be using the stethoscope and some gloves as needed. So I'm going to go ahead and start. Okay. Hello, my name is Elizabeth and I'm going to be your family nurse practitioner student. Okay, I'm going to go ahead and start my assessment. I'm going to have you lay down at about 45-degree angle here so I could go ahead and assess your jugular vein. I'm going to be assessing for any distension. Can you go ahead and move your head, turn your head to the left side? Okay, so here I'm assessing for any jugular distension, which I don't see any noted. For some patients that have congestive heart failure, right-sided heart failure, you're going to be able to see the jugular distended. Okay, go ahead and turn to the opposite side just so I could assess this other side. Okay, no distension noted. You could face forward. So I'm going to go ahead and put my gloves on. I'm going to be checking your chest for any heaves, any lifts, any visible pulsating or thrills. Okay, so nothing is noted. I'm going to go ahead and palpate your over your heart area. So it's going to be a little bit cold. I'm going to put my hand in here. Okay, so no lifts, no heaves, no thrills noted. Now I'm gonna put my hand through your apex area. I'm gonna lift up your gown here. I'll do it through here. Okay, and I'm palpating for any thrills, any hips, any lifts, which is not noted. Okay, so I'm going to be auscultating and auscultate your heart sounds. I'm going to be listening for any S1, S2, S3, S4, any murmurs, gallops, or any abnormal sounds. Okay, so first I'm going to check here on your right sternum border, your second intercostal space, which is your aortic region. I'm going to go ahead and auscultate with my diaphragm. S1, S2 is present. S3 and S4 is not heard. No gallops, rubs, or murmurs present. So now I'm going to go ahead and go to the left sternum border on your second intercostal space, which is your pulmonic area. S1, S2 is present. No S3, S4 heard. No murmur, no gallops, no rubs. So I'm going to go ahead and go under your gown to your left sternum border. This way. And I'm going to check for your fifth intercostal space, and it's the tricuspid region. So your S1, S2 is present. No S3 or S4 heard. No murmurs, gallops, or rubs. And I'm going to go to the midclavicular fifth intercostal space to your mitral area. S1, S2 are heard. No S3 or S4 present. No gallops, rubs, or murmurs present. If I would hear any rubs in the apex area, in the mitral valve area, I would go ahead and be concerned for pericarditis, but I didn't hear anything in this case. So now I'm gonna proceed and listen again in these areas, but now with the bell, which sometimes you're able to hear murmurs better with the bell. Okay. So I'm gonna go again on the right sternal border, second intercostal space in your aortic area. No murmurs present. Now I'm gonna go to the left sternal border, second intercostal space in your pulmonic area. No murmurs present. Now I'm gonna go under your gown to the left sternal border on the fifth intercostal space on your tricuspid area, and there's no murmurs present. And then on your mid-clavicular fifth intercostal space, which is your mitral, there's no murmurs present. Murmurs can be normal in pregnant individuals, individuals with fever, and children. Many are considered innocent murmurs, which children will grow out of them sometimes once they grow up. If we're concerned of stenosis in the valve area that's causing the murmur, we would refer to the cardiologist to do further tests. Okay, so now I'm gonna be listening over your carotid for any bruits, and I'm gonna listen with my bell. Okay, so I'm gonna have you take a deep breath, exhale, and then you're just gonna hold. Okay, so go ahead and take a deep breath, exhale, and hold. Okay, you could take a deep breath, just breathe regular. No bruits present. So now I'm gonna do the other side. Take a deep breath, exhale, and hold. No bruits present. Now I'm gonna do your you could breathe regular. So now I'm gonna do the supraclavicular. I'm gonna assess for any bruise. Okay, no bruise present. Okay, so now I'm gonna do the abdominal aorta. And I'm just gonna cover you for privacy. I'm gonna assess for any bruise and the abdominal aorta. Now in the renal arteries, no bruise present. Now the iliac arteries, no bruise present. And the femoral arteries, no bruise present. Okay, so I'm gonna go ahead and palpate your carotid now. I'm gonna do one at a time. We never want to do both at the same time because we could cause an occlusion and cause cerebral flow obstruction. So I'm gonna go ahead and palpate. So it's a 2+, regular. Okay, so now I'm gonna assess the other side, which is a 2+, regular rate, regular rhythm. Now I'm gonna assess your brachial pulses, bilaterally equal, 2+, rate regular, rhythm regular. And I'm gonna check your radial pulses, bilateral, equal, rate regular, regular rhythm. And since I'm already here, I'm gonna check your capillary refill, which is less than 2 seconds, which is normal, no clubbing, no pill, no cyanosis noted on your hands. Okay, so now I'm gonna assess your popliteal. This one takes a little bit longer to assess. but it's present. 2 plus regular bilateral. Now your dorsalis pedis. 2 plus regular rate, regular rhythm bilateral. And your posterior tibialis bilateral, 2 plus regular rhythm bilateral. Okay, so now I'm gonna be assessing your legs. I'm gonna be palpating. Is there any tenderness?
No.
Okay. So I inspected before and there was no lesions. The skin color is intact. It's light in color, light brown. No draining, no erythema, no tenderness, no redness. Okay. So if there was any pitting edema, we would go ahead and press on the skin, which there's nothing, no pitting edema, and we would rate it from a 0 to 4, depending on how much the pitting would, the distension of the finger would be there. So now I'm gonna do the Holman sign just to rule out a DVT. So I'm gonna go ahead and pick up your leg, and then I'm gonna dorsiflex your foot. Is there any tenderness?
No.
Okay, and now the other leg. Is there any tenderness?
No.
If there would be any tenderness, we would go ahead and do further examination to rule out any DVT. There's no redness, there's no erythema, there's no warmth to touch. So in this case, there's no evidence of any DVT. Okay, so I'm gonna go ahead and ask you if you could lift up your legs just so I could check for any blanching. Just lift up your legs. Okay, and now the other one. Okay, no blanching noted. So now I'm gonna have you take a seat, sit down regular. Right there, just so I can take a look at your skin color. Okay, and go ahead and stand up. Okay, and go ahead and just lift up your heels, and go down. Is there any tenderness when you do that?
No.
Okay, you could go ahead and take a seat. So there's no abnormalities in this case. If we were concerned for any arterial stenosis, she would be complaining of any pain. Circulation looks intact. It goes back to normal. Her color. There's no pallor, no cyanosis. If we were concerned for a patient having an MI, we would probably see patient complaining of chest pain, nausea, vomiting, radiation to the left arm, any jaw pain, diaphoretic. So in this case, this is an emergency. If we have any aspirin in the clinic, we would go ahead and administer 324 milligrams of aspirin, chewable, and call 911 right away and get the patient to cath lab. Thank you for watching.